Hi there, my name is Dr. Nicole Siegfried. I'm a licensed clinical psychologist. I hope you find this video helpful.
Everyone has their own preferences about psychiatric medications. Some people want to avoid taking them at all costs, and others need medications to improve their symptoms in the short or long term. Ideally, your psychiatrist should take your thoughts into consideration and make a balanced recommendation for treatment. They might even give a couple of different options because your participation is important for the best treatment outcomes. Most people seek out a psychiatrist for the first time after seeing a therapist for at least a few months. If symptoms haven't improved enough after some time in therapy, you might need medication. Of course, there are some situations when medication may be needed right away. It's a good idea to talk to your primary care doctor about your symptoms and the treatments that you've tried first. Today, I'll discuss whether you need a referral to see a psychiatrist and provide some tips on finding one that you trust. First, insurance can be super confusing, so let's go over HMO plans versus PPO. HMO plans will require you to get a doctor's referral, and most PPO plans don't require a referral. Some psychiatrists will ask clients to get a referral even if their insurance doesn't require one, and others won't. Even if it's not required, your doctor may be able to recommend a psychiatrist they know and trust. Some therapists can recommend psychiatrists in your area as well. So how do you go about asking for a psychiatrist referral? At your next primary care physician appointment, talk with them about the symptoms that you're noticing and how long they've been bothering you. Tell them what treatments that you've tried so far, and if you've been in therapy for a while, tell them how long. They may have other questions for you, and your doctor may make treatment recommendations after you've shared this information. Some doctors have experience with psychiatric medications, so they may offer to write a prescription themselves. The downside to this is that you likely won't get a great medication management experience. With a psychiatrist, you may have meetings frequently when you're trying a new medication. After you've found a treatment or combination of medication that works well for you, you'll eventually slow down the frequency of those meetings. Primary care doctors usually don't have this much time to spend with their patients. So what if you want to find a psychiatrist on your own? If you have a PPO plan, you can still ask your doctor for a referral or ask friends and family if they work with someone that they know and trust. You can also do a simple search for psychiatrists near me and compare some online reviews to see who seems trustworthy. There are a lot of new online psychiatric services and pharmacies that make it sound like you're getting a much better deal with telemedicine-only networks. The problem with these is that you can't be sure of the care quality that you'll receive. Many of them have great online reviews, but their psychiatrists have high caseloads and short appointments. Many psychiatrists with brick and mortar practices offer telehealth appointments as well. So what should you be looking for in a psychiatrist? Finding a psychiatrist in your community will usually get you more reliable treatment at a higher standard of care and longer appointment times. Local doctors are less likely to leave their practice with little notice, and again, many of these offer telehealth appointments as an option. Here are some questions that you can use to narrow down your search. Do they accept my insurance plan? Will my doctor write a referral if necessary? Do they come highly recommended by someone I know? Do they offer telehealth appointments, or can I see them in person for my first visit? Are they a part of my community, or could I end up working with someone elsewhere? Are they registered with the Better Business Bureau, and what do their online reviews look like? Do they have experience treating my condition? At Lightfully, we do have resident psychiatrists on staff. If you choose Lightfully for higher level mental health treatment, you'll see one of our staff psychiatrists during your very first week. You can talk with them about your history, your symptoms, and the medications that you've taken before. Some clients may need medication during their stay for the best treatment outcomes, and in other cases, it might not be necessary. Our staff psychiatrists may provide education about some different types of medications you can choose between. That's a discussion you'll need to have with your doctor and the psychiatrist. Our staff psychiatrists will be integrated with the rest of your care team at Lightfully, so they'll be able to work collaboratively with staff nurses and your therapist. We encourage all Lightfully clients to take their own medication each day, but it's ultimately your decision. We know treatment works best when our clients choose voluntarily. If you have questions about seeing a psychiatrist during your treatment at Lightfully or whenever you're ready to take the first step, reach out to our compassionate admissions team. They're very friendly, and we'll take the next steps together towards the fullest, brightest version of you.